You always want to make sure you're wearing a mask. Of course, you've got your face shield, your gown, you've got all your PPE on, okay? But you're wearing a mask as well. So I'm going to pretend like I'm putting a mask on, but you guys need to hear me. So I will definitely mask up, and then they're going to mask up too. So just going to put a little mask on. Okay? Okay, so with infection control being number one concern, I'm going to put on, my hands are washed, I'm going to put on gloves. Now, the good thing is you're going to have a little put on kit and a take off kit. Okay, so everything that you need will be right in front of you in this little bag. Okay? Okay, so this is what, once you open up their blouse and look, this is what you're going to see here. Okay, this is where the catheter is inserted, and this is a nice, you're going to be looking for a nice dry gauze. Okay, now if you do see a wet gauze, most likely they probably took a shower, right? Sometimes in nursing homes, a lot of nurses or CNAs, they're not aware that this needs to be dry. So you would report it to the nurse, document your findings, and then when you change it, you're going to look for pus, redness, soreness, stuff like that. So first and foremost, I'm going to have my kit set up here. So what you're going to do is you're going to place the chucks underneath here where your catheter can lay on, okay?
It just hangs there?
It just hangs there.
That's
Yeah.
exactly what you see.
This is exactly what you're going to see. This is right on the money. And then usually some of them are sutured, just kind of the big two sutures, but suture here and here to stabilize it. Usually when they first place the catheter, the surgeon will put a suture in. Then after about 4 to 6 weeks, the sutures, either the patients will cut them out or they'll ask the nurse to cut them. And what happened is, so it's a long catheter, okay? It's going to go in through here over the clavicle, and it has a little cuff in there. So there'll be like a fuzzy little cuff. It's inside, so you can't see it. And tissue will actually grow around it and secure it. So it's kind of hard. It's hard to take out. I know it looks like it could fall out. Do they fall out? Yes, they do. It's very rare when they do. It's something like maybe a patient was in bed and they pulled it out in their sleep. It happens. Very rare, but it happens. They've woken up and looked over and there's a catheter lying there next to them. So very rare. Like I said, maybe once, twice a year I'll see it, if that. Okay, so I got my mask on, gloves. I'm gonna put a chucks here. Then these are all sterile, and of course for the newbies that are here, we're gonna reuse a lot of these supplies. Okay, Miss I has got a great system that she's kind of introduced me to save money, so we can get more things like machines and stuff like that. So after we're done, we're just gonna place it back and reuse everything. Okay, but in the real world, everything's gonna be brand new and sterile. Okay, so you want to start off by putting a sterile gauze under here, and this is where you're gonna be working on top of. Now, you're just gonna take this off. So, I have my arterial and I have my venous, okay? And these are what you call tegoderms. And they're sealed on there. And these usually get changed out about once a week, okay? It'll prompt you on the computer. So every Monday or every Tuesday you'll change out tegos. And it'll come up on the computer. So you'll see it and you'll know right away, okay? So, I'm going to go ahead and what I'm going to do is I'm going to start up and work my way down, okay? So I'm going to go ahead and take off this dressing. Okay, so what I'm going to be looking for on my gauze is any green, yellow, pus, gunk. You're going to get dried blood, that's normal. And then I'm going to check around the catheter site, make sure that there's no pus or anything, redness, angry. You guys will know what to look for.
If you do notice it, you notify the nurse right away?
Yes, you
Okay.
go get the nurse, and usually she'll ask you to swab it, okay, with culture. So everything looks nice and clear. Okay. And you see how it's a good idea to have the patient have a mask on, because now that's all exposed. You don't want him breathing on it or coughing on it. So we have an antiseptic. This is called ChloraPrep. Okay. And you squeeze these and then gel comes out, but I think this has already been, yeah, it's already been. So we'll have a fresh one. And what we want to do is we want to clean the site, and what we just want to do is do little baby circles from the inside out. Okay. And you're cleaning underneath and around it. Okay. Now, while that's drying, I'll get you guys in the habit of, I'm going to work my way down the catheter. And I'm going to take 2 of these alcohol preps, okay? And what I'm going to do is I'm going to take my lines and gently just kind of clean and work my way down to my Tagos. Okay. Place this one down. I'm going to take my arterial and I'm going to go ahead and scrub it. And you want to scrub for about 20 seconds. 19, 20. I'm just going to place it on top of my gauze, okay? This is sterile, but now we're double sterile. I'm going to take a 10 cc syringe, open that. I'm going to connect it. I'm just going to push and twist. Okay, I'm going to unclamp it. And what I'm going to do is just aspirate about 5 cc's. What's going to happen is blood's going to shoot through there. You're going to see some dark blood because this catheter is pretty long. And on the clamp, it'll tell you usually how many cc's long it is. So this is like, we'll say 2.5. Yeah, it doesn't say on the clamp, but they'll have a little bar here that says 2.5 cc's. So you know to pull about 3.5, okay? I'm gonna pull 5 standard, clamp it, put it down. Then I'm gonna do the same for this guy. I'm gonna scrub it real good. 20 seconds. Grab a new syringe. You're always going to use a 10 cc syringe, okay? Even though you're not pulling a full 10, you just want a big syringe to be, you want that suction, because there could be a clot on the tip of that catheter that you need to dislodge and pull out, right? So I'm going to pull 5. Something's clamped back there, so we'll just say I pull 5. Okay, so now I've got 5 cc's here and here, okay? Now I'm going to have a pre-filled 10 cc syringe, okay? It's going to be in a bag. It's going to be pre-filled. That's what this is, okay? I'm going to take saline.
Okay, just make sure.
I'm sorry, I just said pre-filled. I didn't tell you what. It's going to have saline. You're going to take that. Don't touch the tip. Twist it on, and then you're going to flush it. 10 cc's, clamp, and then you're going to get your brand new syringe, 10 cc's of saline. Same thing here. You're going to unscrew that, keep the tip clear, put on the syringe, flush, open this, flush 10 cc's, clamp it. Now it's nice and flushed. So you cleared out your lines. You will pull out little blood clots or dark blood. That's normal. Okay.
What do you
So-
do with this ring without the blood in them?
Put them in the biohazard.
Oh, you don't save it for anything.
No, because they've been contaminated. They're trash. Okay, so while I'm pulling out the blood, flushing these, this is now dry. Okay, so I'm going to take my gloves off, put them in the trash.
I think it's over here.
Wash my hands. You can, and I'll have a pump here. Okay. Put on a new set of gloves. So by the time pretty much by the time this is all done, now my site is nice and dry. Okay. And it just takes a couple minutes to dry. So I'm gonna take a small 2x2, sterile, open it. I'm gonna place it right there on top of my site. Then I'm gonna have a,
Some good tape.
I know. I'm gonna have brand new sterile tape. And I'm gonna, what you wanna do is you wanna tape it. And you wanna tape what's called, this is so bad. Wanna tape a window. What we call a window. So I'm gonna take the tape. Oh my gosh, this is so bad. Here, let's try this guy. Okay, so I'm gonna pull off 2 inches. This is a good tape. Okay, I'm just gonna place it right on the top there. Do the same thing here, and what I'm doing is I'm just framing it in. I'm making a little window. And the last one. The silk tape seems to be pretty good here. Okay, so notice it's nice and dry. I've just made a frame, okay? Now my dressing's been changed, everything looks good. Okay, I'm gonna go ahead and change my gloves. Put some Purell on my hands, wash those up pretty good. Okay, so my catheter's been flushed with normal saline. Now I'm going to go ahead and administer my heparin. So this patient gets 1 cc of heparin. I'm going to administer through my venous, okay? Always when you're giving heparin, go through venous. Okay, open, administer, clamp, and I'm going to let that dwell. How long am I going to let that dwell for?
5 minutes.
Yay, 5 minutes, good job. Okay. So, it's been 5 minutes, they are all ready for hookup. What I like to do is, so, they're ready to go. This is exactly what the dialysis lines look like, and notice how we have red and blue, red and blue. I like to work under, like I said, this is nice and sterile, but I like to work under this as well. You don't want to touch the tip, you don't want to breathe on it, you don't want to cough, nothing. Connect. Screw it on. Same with this guy here too. Connect. Then you're going to unclamp, 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 unclamp. Then you'll start your dialysis machine. And then you're going to take this out, throw everything away, keep it though in our case, get a brand new sterile field, and place it under here. Okay? And then you want this nice and visual, because they're going to be like, where's my blanket? It's so cold. And they're just going to want to snuggle under that blanket. You can still tuck them in. You can get the blanket behind the shoulders, but you have to leave this window so we can see, just in case these lines disconnect or anything like that. Okay. All right, so patient has run. They ran their full treatment. Everything looks good. Time to take off.
Oops.
Okay, so all their blood's been returned. And what color are my lines gonna be?
Like a salmon
Dark
thing.
red.
Pink. Salmon. No dark red. I've returned all my patients' blood, so
Close.
Oh, well, see, that's, you
Close.
didn't tell me she returned it. Well, they're done with dialysis.
they're all done.
Makes sense.
Okay, so clamp, 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 clamp. He's got his on, I've got mine on. Okay, I'm gonna take my alcohol.